Welcome to episode 2 of TNT Unpack's mental health series. We are your hosts, Justin Collymore and Rochelle Amore.
Hey.
Today we're talking to psychologist Dr. Ariane Shepherd about depression. Ariane, welcome.
Hi.
We spoke with Dr. James Bratt on our last episode, and he talked to us about being careful about the mental health professionals we approach because there are some questionable qualifications floating around out there. So before we go any further, if we can just get some background information, just to make sure.
We need to make sure you're legit.
Yeah.
I did my Bachelor of Science degree in psychology. I did a master's in clinical psychology, and I have a Doctor of Psychology degree in clinical psychology. So I am a clinical psychologist.
And where did you get these qualifications, Dr. Shepherd?
I actually did my first degree at UE, and then I went to Washington, D.C. to the American School of Professional Psychology and did my master's and doctorate.
All right, that seems legit.
I think we can take
passed
that.
the test.
I think you've passed.
Yeah.
Okay,
We're good.
So it's our understanding that there are different types of depression. Can you walk us through some of the more common types?
Okay, so clinical psychologists use the Diagnostic Statistical Manual, which is a DSM,
Right.
and we're now on the 5th edition.
DSM-5, right.
Right. And so the different types would be major depressive disorder, which is probably the one we'll talk mostly about today. There is persistent depressive disorder, which is dysthymia, which you may have heard of before. There's PMDD, which is premenstrual dysphoric disorder. There's substance or medication-induced depressive disorder. There's depressive disorder due to a medical condition. So there are different types, but I think we'll mostly touch on major depressive disorder.
Is Carnival to Banker, should that be in the DSM-5?
Carnival to Banker.
Yeah.
When you see your costume hanging up in the closet and you start to cry.
Right, that's more along the lines of grief.
So it is real
But
there.
it's a real thing.
Possibly.
Like a sense of loss.
I'm gaining that sense from both of you that it could be something that...
Anyway, people, like you said, you might experience a sense of grief or loss. And then there are people who, for example, might go through a breakup and be really down for a long time. And that's normal, right? People experience these ups and downs.
Right.
What takes you from having a normal rough patch that you will eventually get over, most of us, into having clinical or major depression?
Right. I think it really comes down to the duration of the symptoms and the intensity. So with grief and loss, it tends to come in waves. You know, you can be very functional and within a couple days or few weeks, it can tend to subside. With major depression, it's much more persistent over a longer period of time and your functioning is a lot more impaired. Grief or loss, you might think about the person that you lost and thoughts of that bring up the negative emotions. With depression, it's more of a hopelessness about the future. Your self-esteem becomes affected. It's a lot harder to get past.
So it's more of like a negative outlook.
Yes, it's a negative
Towards
outlook towards life and about yourself, which tends not to come with grief and loss unless there is this guilt about maybe you didn't see the person enough before they died or, you know, you have different types of grief.
Speaking of that duration, I guess, how long and the intensity and low self-esteem and negative outlooks, would you call those symptoms of depression or are there other things?
Yes, you would actually call them symptoms of depression. If you notice that you're feeling depressed mood for most of the day, every day for at least 2 weeks, along with you're sleeping a lot more than usual, you've lost your appetite or you're overeating, you're not concentrating very well. It's a cluster of symptoms, but if you're feeling this for a prolonged period, which is considered 2 weeks, then you could be having a major depressive episode and that would be a right time to see someone.
So when somebody comes in to see you, how far along are they usually in their depression?
Right. Well, it depends. Culturally, in Trinidad, we're not good about coming to terms with mental health issues. And so people tend not to come in until, I would say, they've been depressed for about a year.
Right.
You know, it would be
Wow.
good if they could come in within the first couple of months because then your prognosis is better.
Sorry, when you say prognosis for the layman out there.
Right. It means that your ability to recover improves the sooner you come in.
Okay.
Right. Symptoms can remit within a shorter time frame than if you wait, let's say, a year. But I think we're very good at hiding our symptoms of depression. Typically, people will come in when it's gotten to the stage where their life is
Adversely affected.
Yes. at work, socially, a lot of times it's someone else calling in saying, listen, this person needs to come in.
Yeah.
Can you give us an example of a situation where the person was really badly affected? Because I don't think we always understand how badly mental health issues can affect our everyday lives.
Right. I think with depression, worst case scenario would be someone attempting suicide. You know, that would be typically a huge red flag. If someone finds out about it, would make sure that person gets some help.
I heard on the radio a few weeks ago, they were talking about steel workers who lost their jobs and that there were reports of attempted suicide. The guys on the radio were talking about how, you know, it's so silly that you would try to kill yourself if you lose your job. Just get another one. Or by any means possible, you have to get out of that situation, and implying very strongly that the person's not strong enough and the person was trying to take the easy way out. And I got really offended by that because I thought they had no idea what it must be like. Because we've spoken so far about loss, we've spoken about grief, we've spoken about how it affects your self-esteem, and all those things come into play, I'm sure, when you lose your job and you lose your ability to provide for your family.
I think the important thing to first understand is that grief and loss and major depression can occur together. Right? So someone who is experiencing a loss can also have major depressive disorder, and you will tend to find that those are the people that will react more adversely to the loss. So the example you gave of the person that attempted suicide because he had lost his job, that's a type of loss that, you know, was not temporary. It's not something that came in a wave and then he got over it. It's something that really affected his self-esteem, really affected his hope for the future. And so you're looking at someone who had a predisposition to depression to begin with, and then the loss was an environmental factor that sort of triggered that.
So when you're talking about people who think that they don't have any other option, you're talking about people who have been experiencing things all along.
Yes.
We spoke about people having a negative outlook towards life. Is it that there's people who sort of have a negative outlook and then they become depressed, or do they develop a negative outlook because of some sort of chemical imbalance or
right.
something
So
like
whether
that?
it's the chicken or the egg.
Yeah.
I think that with any mental health condition, the genetics only accounts for a particular percentage. Right. And so you can have someone who's genetically predisposed to depression, which means that first-degree relatives have suffered with depression. But that doesn't necessarily mean that the person is going to develop depression. It just means that their chances are higher. So then you have to look at environmental factors and temperament, which is what you would have meant by negative outlook. And some people are just more negative than others in the way that they think. And so that plus being genetically predisposed sort of comes together and triggers that expression of depression.
So let's say you have a patient coming to you and you pick up that they have this negative temperament.
Right.
How do you go about sort of shifting their way of thinking?
Right. So the most common form of treatment for depression is cognitive behavioral therapy, because it works on the premise that your cognitions, which are your thoughts, tend to drive your emotions. So if you wake up in the morning and you think, I'm going to have a crappy day, then you suddenly find yourself in a bad mood. You get in the car, you get angry with the people on the road. It just sort of spirals from there. Negative thinking leads to negative emotions, and negative emotions leads to negative behavior. And so the cognitive behavioral therapy tries to target the negative thoughts, because people who are depressed tend to have a lot of cognitive distortions. They just see things in a very negatively biased way that then feeds the depression. And then because of the negative behavior and the depressed feelings, that then feeds back into their cognitions and reinforces negative thinking.
Cognitive behavioral therapy, CBT for short, targets your thoughts and changing the way that you think to change your outlook and help prevent you from going down that depressive route.
Yes, it tries to target the negative thinking.
Okay.
And by extension, your negative behavior. Because we're saying negative thoughts lead to negative emotions, which we can label as depressed mood.
Right.
Which then leads to negative behavior. So a depressed person is not going to be throwing a party.
It's an odd thought.
Right.
Yeah.
So they tend to do behaviors that then reinforce their depressed mood. So the cognitive behavioral therapy posits that if we help change that negative thinking and we help with increasing more positive behaviors, the depression is likely to be alleviated. Symptoms will be alleviated.
A lot of times, from the imagery we see on TV, so you always get Freud or some psychologist, and then there's somebody lying down on a couch talking to him. How does talking therapy actually work in the real world?
Talk therapy, I think, is a very simple way of defining what happens in the therapy room. I think it's much more complex than that.
Yeah, because I think if it was just talking, then you could just go talk to your friends.
You could just go talk to your friend.
Mm-hmm. So what's the difference?
Well, I think the psychologist or the person, the professional that you're going to, you're trusting that they have a certain amount of clinical experience and knowledge about mental health conditions, so that when you speak to that person, not only are they objective, but they give you that expertise to help you work through the mental health difficulties that you're experiencing.
I think a lot of times when people get depressed, like they kind of get the sense, oh, nobody knows how I feel, and
Yes.
but you as a psychologist, for you,
Right.
it's the opposite, because you've been through that so many times with so many patients. You
Right.
know exactly.
But even
to deal
so,
with it.
I think that is one thing that is very true of people that suffer with depression. I think it's very, very hard for another person to understand what that person is going through. And that's why talking to a friend, they might say, you know what, suck it up.
Yeah.
It's not that bad. You have all these things going well for you. Why do you feel that
Yeah,
way?
I think especially in our culture, people are kind of just like,
Right.
nah, don't worry about that,
Right. It's not really rational, but the depressed person is not able to see that. And so it takes a professional who I think could have a bit more patience with that process, where the person is negative every day, and be able to help that person, or just accept that that's where the person is right now.
How do you keep your patients up and you keep
Right.
persisting with the person?
Well, you have to focus on their strengths. I mean, a lot of times patients come into you and they're talking about the things that are going wrong or the things that have gone wrong in their life. And I think if you as the clinician also focus on that, it can be quite a depressing situation. But, I think it's always important to remember that people are quite resilient, and the fact that they're sitting in front of you means that they've survived these things and that they do have the ability to cope, they just don't have the tools.
Right.
And so the clinician's job is to help that person that does have that strength in there somewhere to utilize the tools to help themselves become more functional.
Right.
So, full disclosure, I've had cognitive behavioral therapy.
Okay.
And when you talk about tools, I remember we did exercises.
Right.
And one of my favorite exercises, because I am childish, is he told me, when you have a negative thought, which, I mean, when we're talking about shifting thoughts, people might say, well, it's not that easy to control your thoughts.
Right.
They just come as they come. And he would talk about, okay, you have that negative thought, but you don't have to dwell on it and you don't have to let it go on. He was like, think about it as a train, or I guess in Trinidad, as a bus in Citygate leaving the station. Let that bus leave that terminal. You know what I'm saying? Do not go anywhere with it. It came and then you just leave it right there. And I thought that was a really great way of helping people understand how you can control your thoughts.
Right. And just to add to that, I think what comes even before that is being able to recognize that you're having a negative thought. I think people that suffer with depression, the negative thoughts are so automatic that they don't recognize the negative thinking, they just recognize the depressed mood.
Right.
And so it's important to teach them how to recognize the depressed thought so that they can stop that.
Yeah, I know a lot of the theory behind meditation, for example, is to raise your awareness so that you are actually aware that you are having a negative thought, rather than you just think, oh, well, this is something that's happening to me.
I think there's a lot to be gained from mindfulness. I think one of the things that depressed people do a lot is they ruminate about the past. And, you're looking back at a time that you can't change, you can't do anything about, and so that leaves you feeling very helpless and hopeless. Meditation or even mindfulness, it positions you in the present, and so you're not constantly looking back, and that is what I think helps a lot with depressed mood.
As a psychologist, I know we spoke to James and he gave us the distinction between a psychologist and a psychiatrist. Have you ever had to refer one of your patients to a psychiatrist?
Absolutely.
And what are some of the things that led you to
Right.
making that decision?
You had asked earlier, at what point do people come in for help? And for someone to benefit from cognitive behavioral therapy or even talk therapy, where you're encouraging the person to be more self-aware and to gain insight, they have to have a certain level of functioning.
Right.
And sometimes the person comes in so depressed that they're not going to benefit from the talk therapy until their mood improves a bit. And so at that point, you recommend an antidepressant, psychotropic medication to help stabilize their mood a bit so they can come back to the therapy and benefit fully from it. The medication and the therapy go hand in hand.
We did talk a little bit more about how that medication would work with James. So if anyone's interested in that, they can check episode 1 out.
Right.
As you said, not everybody in Trinidad and Tobago and the Caribbean in general appreciate mental health professionals and would take it upon themselves to come into you. Right. So have you seen examples of where people try to self-medicate before they move to the point to come see you?
Absolutely. I think that one of the common ways that people hide their depression is drinking or smoking marijuana. It's a way that they try to ease the depressed mood without, actually taking that step to get help.
Any other strange ways of improving their moods that you've come across?
I wouldn't really label it as strange. I think it seems like the best option at the time. It's just not the most helpful.
I think it's interesting that so many people go out in everywhere in the world pretty much and just get drunk. It's like a goal of theirs to get drunk. Why have we evolved in that way?
Culturally, we seem to gravitate toward copious amounts of alcohol.
Yeah.
I'm not sure if it is depression that gets people there or just it's the norm. Mm-hmm. And so people start drinking from an early age, smoking from an early age. The unfortunate thing is that adolescents who start drinking and smoking marijuana do have a higher likelihood of depression and anxiety in their adult years.
Is it because they don't develop mechanisms to cope with the challenges that
Well, it's actually because these drugs do exacerbate depression and increase levels of depression. It starts off they are trying to ease the depression, but over time it contributes.
So it's doing the opposite of what you're trying to make
Correct.
it do. That's important to note. The next time I feel like taking a drink because I'm stressed out.
Well, I think anytime you try to fix a problem with a very short-term solution, you're not looking at long-term success.
So we're talking about things that are culturally specific to TNT. And having worked and done your studies in Washington and then practicing in Trinidad, are there any common themes that you've noticed with depressed patients when they come into you that come up time and time again?
No, I think that it's pretty universal.
And that's refreshing for people to understand that it's not just you at home feeling this way. This is a universal thing. People all around the world struggle with, grief and loss and having relatives with depression and trying to self-medicate and then these negative thoughts and these negative moods and these behaviors. I think that's important for people to understand that it's something that happens all around the world.
Yes.
Yeah.
Do you have any professional advice for people who are kind of going through some rough times right now, but they're not quite ready to see a psychologist?
Okay. Why are they not quite ready to see a psychologist?
I don't know. Let's just say maybe they can't afford it or maybe they just feel like they don't quite need to, but they...
Also, there's a huge stigma. Like, people hate admitting that when I talk very freely about my mental health issues because I feel like it's obvious from this podcast that I do have some. But people don't like to even admit that they want to see a psychologist. Right. People whisper to me like, can I get a number for practice? Right. They don't want anybody to know. So if you're struggling with making that step, is there any advice you have for that person?
Well, I think, we need to sort of get rid of a lot of these misconceptions and preconceived ideas of what it means to get help. I think that it is actually a sign of strength to say, I'm not functioning. I'm not the best that I can be. Let me try to get some help to see how I can, be a better version of myself. It's really in, the person's best interest, because while you do nothing, your behavior will be negative, your thinking will be negative, your emotions will be negative, and you're just prolonging this period in your life. My advice would be to see it as a sign of strength, to really consider that things can improve for you if you do try to get help.
I knew a person who, I recommended that they go see a therapist, but they just doubted it from the start. They're like, how is this person going to help me? I don't want somebody just telling me to be positive. So do you think that people feel that way initially?
Yes, I do think that like anything that you've not tried, you tend to have assumptions about that thing.
Right.
Particularly when there's so much in the media that portrays therapy. For example, lying down on the couch, being analyzed, people telling you, well, just think positive thoughts. Therapy is actually a lot of hard work.
Yeah, I think a lot of people don't realize how powerful it is.
Yes, it's a lot of work on the part of the patient because it's forcing that person to become more self-aware. And I think a lot of times people spend so much time hiding from themselves that it could be a painful experience. But, that being said, I think that just as you would shop around for a dentist or a GP, you may need to shop around for a psychologist, and not everyone will be a good fit for you.
Right.
So you may try and say, you know what, I went to this one person, didn't like them, I'm never going back. But it's important to keep looking.
So for somebody who's looking around for a mental health professional, what are some of the things they should look out for? Because as James mentioned, there are a lot of people who might not be qualified.
It's important to look out for qualifications. I think that in Trinidad, things are a bit different in the governance of the field. So it is important to ask about experience and qualifications, and nothing is wrong with that. When you go to the person's office, their certificates should be on display. They should be able to tell you what they specialize in per se, and so that you can feel comfortable.
And I think also on that note, talking about finding that fit for young women, for example, it can be a difficult experience. Like you said, therapy is very hard work and it can be very painful and very difficult. So maybe if you're more comfortable with an older woman rather than a man, some women, they just don't feel comfortable having that personal experience with someone of the opposite sex. And the same goes for young men. But we did talk about it being not affordable for everyone. And I just want to throw in that I recently have a friend who went to UWE's free counseling services, and she was very impressed with it. And like you said, it was not what she expected. She thought it would just be like a conversation and think positive thought, but it was a lot of work. She got exercises to do, she got affirmations, she did have to confront a lot of things. And so I think there are some great free services available out there that people can also look into as a first step.
Are there any habits that you'd recommend that people try to start developing?
I think exercise is one. Just taking care of your body, whether it's exercise, eating well, having regular checkups. I think it's very important to take care of yourself, self-care. People think self-care means I'm going to go to the spa and spend the day. Sometimes it means, ironing your shirt the night before so that when you get up in the morning, you don't have to spend 15 minutes doing that. Washing your clothes over the weekend so that you don't have to worry about that during the week.
Right.
So I think it's very important to do that. And I think sometimes because of the routine and the schedule we get into, the traffic and the 8 to 4, and we just tend not to spend a lot of time inputting in our lives positivity and good practices. And that's why, things like Carnival just become this release because you spent the entire year not really doing anything for yourself.
A lot of times when we get stressed, Rochelle and I resort to eating KFC.
Right.
It's amazing.
Well, comfort eating is
so good.
Well, it's something that it's short term.
No, but I think that's great advice. Exercise, eat well, but I think that self-care, small things to do to make your life easier can go a long way.
Well, it's really just under this whole umbrella of loving yourself. You are your tool. You're the only thing you have to put out during the day. When you work, when you raise your kids, when you go to school, it's you. So if you're not putting back what you're taking out, you end up in a deficit emotionally, and that tends to make you more vulnerable to depression and other mental health conditions.
If you are interested in maybe getting some referrals, Justin and I both have a background in psychology, and clearly I've been around the block when it comes to mental health services.
Is that Justin a mental health professional?
Am I a mental health professional?
I don't know. Are you any professional? So you can reach out to us at unpackmedia@gmail.com, and we will try our best to just give you just some general options. There's also a listing of mental health clinics around the country. You can get that from Port of Spain General Mount Hope. Those hospitals should have the clinics in your area that are free. So great. Thank you so much.
Thank you very much.
Take care.